Hello guys, welcome to my YouTube channel Ayurveda Baskin. So today we are going to discuss our Nidana paper 1 best MCQ, and with this MCQ I explain small concepts also. So maybe same MCQ will not come in our paper, but a kind of example or kind of concept will come. The first question is that is from the Upshya and Upshya. We have to select the correct statement. Out of this is the right statement I have already written here, that Shundi is given in the Shita Javra. So it is actually one of the example that is given in the Oshadha Hetu Viprita. So you should study this Upshya and Upshya table. There are 18 type of Upshyas are mentioned, and that is surely come in exam with an example. So you can study that thing very surely. Next question is, it is from actually your Roga Marga topic, and from Roga Marga it is asked Gulma, Ashas and Vidradi are included. Actually there are total 5 diseases that they are mentioned under 2 subheadings, that is Shaka as well as Koshta, and they are Shavethu, Gulma and Ashas Vidradi. These are the heading that are mentioned in both, so right answer will be the A and B option. Next question will be the appearance of the rain or cold season during summer. So that is actually the Mithya Yoga of the Ritu, because what is happening in Ati Yoga, if summer season in there is a so hot days, and if it is a yoga means not at all summer will be there, and Mithya Yoga, what is happening, another Ritu's features are there. For example, in summer Ritu there will be a feature of the rain or cold. In Javra, which type of Sroto Dushti will be there? So in Javra, what is happening? There is in the Sangha, and Sangha of specifically this Rotas, Rasa Vaha and Svedavaha. That's why there is a no sweating and Ama manifestation in the Amasha. Site of Ama as per the classical references, so it can be on the Rasa Dhatu level, it can be on the Amasha, Pratham Dosha Dushti, or it can be on the different Dhatus level. Then Kati Swapna in the waist is seen in. So Kati Swapna is one of the Medas Shaya Lakshana, and I have mentioned this quotation here. You can see the Medas Shaya, what is happening, Medasi Swapnam Katiya Plehano Vriddhi Krishangata, and like this from Shaya Vriddhi MCQ can come, because this topic we already studied in the first year, so chances of MCQ are high. Kamla is a type of, so Kamla is what is happening, Kamlati, a person is not having a desire to the food, so it is due to its Prakriti we are giving Kamla as a nomenclature to this disease. Arshas is included in dash type of Vikara. So actually 2 disease you have to remember this, Kushta and Arshas are mentioned in the Adi Bala Pravarti. Adi Bala Pravarti means there are 2 types, Shukraja and Shonitaja. Second, that Janama Bala is actually basically due to the Maturam Ahara Viharam, due to the regimen followed during the pregnancy, and as well as due to the Dovharidam concept in the pregnancy. So there are some other diseases that is happening due to the Janam Bala, that is Pangu, Badiram, Andam, Mook and Vamanam and Miminam. Which of the following diseases are usually seen in Atikrisha? So Atikrisha person may usually this all diseases are seen, Pleham, Vriddhi, Kasa, Pipasa and all of this. If Pratisya is not treated immediately, it will lead to manifestation of the Kasha. Actually this is from the Nidana Arthakara Vyadhi, where one disease is becoming the Nidana for the other diseases, and I have drawn one flow chart here. From here we can conclude this. If Javar is not treated, it can end up with the Amla Pitta and vice versa. If Rakta Pitta is not treatable, then it can ended up with the Javra, and we can take the dengue fever as an example. And if both are not untreated, then it can lead to the Sosha. So first this point you have to remember. Then any Vriddhi, we already studied in Udara that if any type of Udra, it may be the Pliha Udra, Chhadda Udra, Baddha Udra, all type of Udra will finally end up in the Jala Udra, and this Jala Udra can lead to the Shofa, because it can lead to the whole body Shofa, and that will become the Asadhya. Then Ashas is the Nidana or the cause for Gulma as well as Udra, because when we studying this Udara Nidana, we already studied this Gulma, this Ashas is one of the Nidana. Then if a person is doing the Diva Sapna, it can end up with the Pratisya, and this Pratisya can lead to the Kasa, and if Kasa is untreatable, it can lead to the Shaya or Rajakshma, and Rajakshma finally end up with the Sosha. So these are the some Nidana Arthakara that is mentioned in a Charak Samhita. Next is the Bala Vriddhikara Bhava are mentioned. So generally what happening, this Bala Vriddhikara Bhava is mentioned in the Sharira Sthana of the Charak Samhita. So right answer will be the B option. Rajakshma is included under. So Rajakshma is included under Madhyama Rog Marga, and some of the other diseases I have written here like Pakshaghata, Pakshagram, Aptantrikam, Arditam, Sosham, and all the diseases of Sandhi and Asthi along with Guda Bhramsham, and all the Marma diseases are included in the Madhyama Roga Marga. Then I will ask one question from you. You have to tell me, is Rog Marga is present in healthy person or in a diseased person? So whoever knows this answer of this question, they can comment like Rog Marga is present in healthy person or a diseased person. Next question is shrinkage of the ovary after menopause is an example of. So shrinkage of ovary is an example of atrophy. What is happening in atrophy? Size of the tissue or organ is decreased, and basically what is happening, size of a cell is decreased due to tissue size decrease, and as well as the organ size. Next is hypertrophy. Hypertrophy is when size of the cell increases. For example, when a person is doing the weightlifting frequently, his muscle will build up. And hyperplasia, what is happening, number of size is increasing. For example, endometrial hyperplasia. And metaplasia, what is happening, in mature one differentiated cell will change to another. Like in some chronic conditions, what is happening, if a person is doing so much smoking, what will happen, his normal ciliated cell will change with the squamous metaplasia that is happening in the common smokers who is chronic smoking. Then Bitot spots are the signs seen in which part of the body? So Bitot spot is seen in the eyes, and there are 5 stages. First is the night blindness, then conjunctival cirrhosis, Bitot spots, then corneal cirrhosis, and keratomalacia. Which of the following is incorrect with the Sukha Sadhya? So what is happening in the Sukha Sadhya? We will say that dosha and dusha and prakriti all should be irregular, and they should not be common, and there should be one roga marga involvement, and the sign, symptom, nidana, purupa all are in the mild form. But D option is not correct, because if a disease is curable by Shastra, that is known as Krichra Sadhya, that is not a Shukha Sadhya. Next question is development of the Vata dominant disease in the Grishma Ritu in a 67-year-old patient is example of. So first of all, he is a Vata predominant, then the disease is happening in the Grishma Ritu. After that, he is a 67-year-old, means he's a like last part of the lifespan. And what we are saying in the basics, like in first part of your life, kapha is predominant, in middle pitta is predominant, and last year in aging vata is predominant. So many things are coming in common, and he is in a Grishma Ritu, and disease is also of chronic. So this is a Krichra Sadhya diseases. Namaste stand for, so Namaste is actually one of the electronic portal, and where so many disease nomenclature or standardized terminology are explained, and it is with the accordance with the WHO ICD-11. So full form will be the National Ayush Morbidity and Standardized Technology Electronic Portal. Next question is Bhayam Visyaden is an example of, so actually it is taken from the Anumana, and there are so many like this kind of influence are mentioned. So for further MCQ can come, then you can read, there are so many given, so you can remember some important one. Atisare Sambanam Mashurad is an example of again Upshya. You have to study Upshya very nicely. So right answer will be the Vyadhi Vipritam Anna. Then which of the following is the Shakha Gati? Shakha Ginti means Koshta to Shakha. So Koshta to Shakha we have Vyayama, Takshanyat, Ushanam Ahit Acharas, or Drutvat Marutasam. So out of this, Takshana will be the right answer. Which of the following is a symptom of Vata Vriddhi? Is a Kasharnam, blackish discoloration. Prameya has a which type of Srota Doshti? Is having a Ati Parvarti, because polyuria is there. Then which of the following is the features in the Nirama Kapha? So Nirama Kapha is a Gandha Rahita. Which among the following rasa is observed in Nirama Pitta? Pitta is having in Nirama Vasta Kattu as a rasa. So right answer will be the D option. Adi Bala Pravarti Vyadhis. So Adi Bala means Matraja and Pittaja related. There are 2 Vyadhi, I have already told you, Kushta and Arsash. In spite of consuming different food, different habit, age, some have a common disease, and that is known as a Janapad Udamsa. That's why the nidana for this is known as a sadhar nidana, because they are common to all the people and lead to a disease to a large population living in a particular area. Following is the nidana arthakara vyadhi of Shodha. Again we have done this question, udara. Na cha tulyam guno dusho na dosham. So there is nothing is similar, so it is easy to cure. Right answer with the sukha shadhyam. Pipalika bahar harnavat is a mention, so it is actually one of the simply given in context of sara, like importance of sara, why we have to examine the sara of a person. Asthma is a type of hypersensitive, so it is a type 1 that is predominant of IgE antibody. Next is a severe form of undernutrition that result from prolonged deficiency of protein, carb and fat, that is marasmus. Next is kwashiorkor is only protein, so they have some edema but they are severely emaciated one. Which among the following is a hypersecretory endocrine disorder? So out of this hypersecretory will be the this Hashimoto is having an insufficient production of thyroid, so there will be a less thyroid hormone. In addition, there is a too little cortisol, and insipidus, what is happening, your ADH is not properly produced or responded. But in Cushing's syndrome, what is happening, there is a high cortisol level, so right answer will be the C option. Morbid condition caused by the etiological factor as described in the text is known as a lakshya nimitta, and there are 3 type of this dushti: lakshya nimitta, then lakshana nimitta and nimitta anurupam. So out of this, lakshana is basically due to some body mark that is generally from the past deeds, and lakshya is the etiological related, so right answer will be the D option. Which of the following is a sign of ojoshaya? So ojoshaya leads to the murchana. Then which among the following is not included in Vyadhi Bala Pariksha? So Vyadhi Bala Pariksha is actually we are measuring the Vyadhi. So we have this Hetu, Desha, Kala, Dusha. But this Ahara Shakti is basically for the patient. So it is a Rogi Bala Pariksha. Right answer will be the option C. Fill in the blank that dash Yat Shariram Sattva Prakritam. So right answer will be the Sahajam. Yat Sharira Sattva Prakritam. This is Yukti. Next question will be the professional and patient health related education and health administration is the example of which type of digital health? Right answer will be the telehealth. Next question will be the Vato Unmade Trishnam iti. Again it's from the Upashaya. Answer will be the Hetu Vipritam Tadarthakari. Then which of the following is corresponded to the dosha gati? So again from dosha gati, so dosha gati upsha, like every time question is coming, so you have to study this concept very nicely. From Koshta to Shaka we have this Vyayam, Ati, Ahit, Ashna, Takshanya, then Drutvad Marsam. So right answer will be the option C. Then which of the following is comes under Ati Pravarti? Atisara is coming under Ati Pravarti. Shabda Asahishuntam is a symptom of Rashashaya. Clabium is a feature of Shukrvas Roto Dushti. Fenavan is a symptom of Nirama Kapha. If Kapha in the Ama, then this is a Avilam will be the symptom. Then Janama Balam Pravarti is a Vyadhi type of, so it is a type of Adhyatmika. In Adhyatmika 3 are there. One is the Janama Bala, second is Adi Bala and the Dosha Bala. According to the Charaka Acharya, Ati Sthula have, so Ati Sthula have basically Ashta Dosha, and I have enumerated this here like Ayusho Hasho, Java Uprodam, Krichra Vyayavada, Dor Ballam, Dor Gandham, Sveda Bhavam, Shut Ati Matram, Pipasa Ati Yogam. And again like Nidana Arthakara, we have already done this topic. Then practitioner group, practicing the proper dietitian is an example of Yukti Kritam. Then Subhaddam Sandhi is an example of Samhanna Pariksha, that is coming under Rogi Bala Pariksha. Then Manda Cheshta is a feature of Vata Shaya. Example of PAM, that is protein energy malnutrition, is your Kwashiorkor. Next is disease with Alpa Hetu, Alpa Pururupa and Trupa comes under Sadhya because that is easily treatable. Harit Parsho Pida is seen in the Purisha Shaya. Next is the Dhatu Paka. So I have written one important shloka. You must remember this shloka, but because you can write this shloka in many questions, because this hyperimmunity or autoimmunity, hypersensitivity, this all are explained in dhatu paka in syllabus. So if any question come from that part, you can explain these things through Ayurveda. So you can learn this yoga. Only 2 line shloka are there, and maybe MCQ will come. So out of this, dhatu paka lakshana will be the Gaurava. Arishta magnitude due to the past deeds. We already done. Past state is basically lakshana nimitta, and lakshya nimitta is basically due to the etiological, which have proper nidana, and we can say this is the nidana for this. Centralized digital repository for the comprehensive patient information is known as electronic medical record. Next is Surya Megha Udev Nishi Vriddha Mayati is the lakshana of Samavata. It is it having an aggravating symptom on this time. Gulma, Ashas and Vidrisi come, and again repeated question, Bahaya and Abhandra Roga Marga. Then Nidra Brahmchas is a disease seen in the Vata Vriddhi. Hriditava is seen in the Kapashaya. Then Atya Abhishanta is a nidana of which Sroto Dushti is a Mamsa Sroto Dushti. Next, Anga Goro is the lakshana of which Dhatu Vriddhi, so it is actually the Majja Dhatu. Then Shula comes under which type of lakshana? It is a Atura Samveda. Means if a patient is having the pain, that he can tell us like he is having a pain. We can just assess him, but the pain type and the pain kind of only the patient can feel. So that's why it's known as a Atura Samveda. Which lakshana a patient can only feel, that is the Atura Samveda, and which like a physician, for example, palpating something, so he can know the inference of that is, that is known as a Vedya Samveda. Type 1 diabetes is a Jataja kind of Vyadhi. Then Atulyam Ritu comes under Sukha Sadham, because Ritu is not the favorable with the dosha Visheshan, so we can read the dosha easily. Marfan syndrome comes under which category of Ashtanidita, that is a Ati Dirga. Most Dushpariharam among the Janapadodamsha is a Kala, because we can't avoid it. Out of this, which is not a Nidanarthira, Kushta leading to Ashmare. Maranam comes under which type of Sroto Dushti is a Ojoshaya. Then Shirna Purna Lochana is a symptom of which Sara, so actually it is a Shukra Shara, because they having a beloved eyes and a good look. The tuberculin test comes under which type of hypersensitivity? Actually it is a type 4 delayed hypersensitivity. Edema is a prominent symptom in which disease? Edema is prominent in the Kwashiorkor, because they have protein deficiency, but they have some edema. In marasmus, they are severely emaciated one. What is the main purpose of machine learning in AI? To allow machine to learn the data. Then Pushpitam Indriyam of the Indriya Sthana basically deal with the Arishta Lakshana in case of order. Then what is the primary aim of treating Updrava? To address the disease and address the disease and prevent that complication or treat them. Swimming in Urustambha produced by the excessive strain in example of Hetu Vyadhi Vipritam Tadarthakari type of Upsha. So we are ending our session here. Okay, thank you guys.